Hello everyone, good morning, greetings for the day. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be doing good today. Now, there are so many problems associated with skin conditions, starting from tanning, from rashes, acne, pigmentations, and on and on. And acne is one of the major concerns that keeps us bothering now and then. So, a few of the common conditions, as I just spoke about, and acne is definitely a big concern out of it. Whether you are a teenager or an adult, acne is one thing which you can have anytime, any day. And it is just not a skin condition, it also hampers our self esteem, it also hampers our confidence, and thus it becomes even more important to talk about acne. Now, many times, what we as laymen do, we try to treat acne by ourselves. We will try, some home remedy or go over the counter for some medication, and that is something which actually worsen our skin condition. So it becomes even more important, which is a qualified dermatologist. So today in this session, we are going to talk about acne, the management of acne from an expert. And the expert is Dr. Rhea Shetty, who's joining us from Mumbai. So with her, we'll have this session where we will talk about, what are the acne lesions, what are the causes, what causes these acnes, and how and when to manage it, and also about how important it is to understand that home remedies, or applying various kind of things on our acne, or trying to puncture it, these all can be very, very harmful for our skin. So today we are going to take advice from an expert, Dr. Rhea Shetty. She'll tell us in length, in detail about acne management. And we'll also try to understand the maintenance therapy, because we all know if you have had acne, you will agree with me that acne is one thing and maintenance therapy for acne is another. And taking care of the scars, the marks that acne leave is a big deal. So we'll try to include everything, starting from management of acne to maintenance therapy to how to get rid of those marks, or in the first place not get those marks that acne normally leaves. And do sunscreen also play an important role in my maintenance of acne, or maintenance of those acne scars or marks? We'll also try to include that part as well in our session. So today we are going to talk about acne management, and we'll have with us Dr. Rhea Shetty, a renowned skin expert hailing from Mumbai, with over a decade of experience in dermatology, venereology, and cosmetology. Dr. Shetty is a trusted consultant dermatologist. Her profound expertise extends to clinical dermatology and cosmetology, making her an expert, a connoisseur of this field. Dr. Shetty's academic journey is marked by excellence, having earned her MBBS from MGM Medical College in Navi Mumbai, followed by a diploma in dermatology and venereology. Further enhancing her skills, she pursued a fellowship in infectious diseases from the esteemed Australian University of South Wales. Additionally, she holds a certificate course in diabetic care, aesthetics, and cosmetology. Notably, Dr. Shetty's contribution is reflected in her clinical practices. She has authored papers featured in both national and international publications, showcasing her dedication to advancing dermatological knowledge. Based in Meera Road, Mumbai, Dr. Shetty is widely regarded as a leading specialist in hair and skin care. So we have with us Dr. Rhea Shetty, our expert today, and she's the one who's going to tell us, why it is so important to manage acne, how to manage acne. And acne, I'm sure, is one thing that has bothered most of us. And it is something, because normally we regard it as a teenage thing, during teenage or adolescence we get these acne, but it's not so. Even adults get acne. And those who have acne prone skin, or those who have oily skin, this is something this problem of acne is something that also hampers their self-esteem, their confidence level. So it's just not a skin condition. It extends from skin condition and being something which keeps us bothering. So look do matters a lot because it's the first thing that people normally notices about you. But it's also important to understand the cause of acne, that why acne is caused. If it is just due to the oil glands, etc., or there's something wrong going on inside our body. So we have with us Dr. Rhea Shetty. Welcome, doctor. Hope
Hi.
you're getting my voice.
Yes, and I'm hoping I'm audible right now.
Yes, doctor, very much audible, loud and clear. So, doctor, it's such a pleasure to have you with us today for this session.
Likewise, thank you for having me and thank you on educating people on such an important topic that's acne. So it's been a pleasure.
Mhm. So, doctor, to start with, because acne is such a big concern for most of us, I'm sure, almost everybody goes through that phase where we get acne, and there are so many people for whom acne is a long, long problem. It's just not associated with their teenage days or so. So, first of all, doctor, what is acne? How it is caused?
So when we come to describe acne, we have to understand that it's a chronic skin condition. Now, to put it in a very simple words, what basically happens is every person has a hair follicle. When this hair follicle gets clogged with the dirt, with the impurities on your skin, with the sebum, that's when there's an inflammatory condition which is called as acne that erupts. Now, this can range from your face to your trunk. Trunk basically includes your chest, your back, or your forearms. There are various aggravating factors, but per se, in a wider description, this is how we state acne to be.
Okay. And after many a times we see that, acne, forms in various patterns. Many a times we see butterfly patterns, on cheeks, on nose, many a times alongside the jawline. So, do they tell us something? Are they symbolic that, this pattern means this pattern means that? Is there a correlationship?
So before we dive into it, we need to understand there are various types of acne that you can see. First, basically
Mm-hmm.
being as comedons, which in layman words we say as blackhead, whiteheads. The second being the pustules. The third variant, which includes a little severe type of acne, that is the nodular and the cystic acne. So when these are the composition of the basic stream of acne, how you can classify them. Now, when it comes to your face per se, if you definitely the position of the acne helps in identifying the inner causes, like the ones who have commonly on the chin area. Those are more towards your hormonal acne. So any hormonal disturbances, any PCOS or any such underlying disease, most commonly you can see the acne towards your chin area. The second identifying feature on your face would be the forehead part. So especially during the people who use a lot of hair products or have started a new hair regimen or have a lot of oily scalp, they normally see the acne on the forehead, the temple areas. So this is again an identification feature if this. Rest coming to the cheek, like you've identified it as one of the butterfly area, that is where we normally see the rosacea kind of acne seen. So these are few identification feature when you walk into our cabin, we see, analyze your face, and then we can identify what can be the cause.
Right. And who are those, who are more prone to acne? I mean, we all know oily skin is one thing, risk factor, definitely. What are the other risk factor who all are at risk, doctor?
So it's actually a wide array when we talk about risk factors. Now, if you are in the early teenage years, you cannot help it, but there are going to be hormonal fluctuations in this. The more triggering factors is if you have a genetic predisposition to acne. That means either your mom or your dad or someone from your near, like your mama or your chacha from your dad's side. That's your genetic pooling. So if that genetic pooling has acne, has one of the symptoms on their skin, then you are more predisposed to acne. The second, when the risk factors is that I'm seeing a lot of teenage male, female being on the obese side. So when you are a little obese or when you are a little overweight, that's when your hormonal fluctuates even more than what it is supposed to happen. And then there's a triggering of acne. Now, third being who don't have a very good diet. That's when those are again prone to risk factors. And these are the most common risk factors that we can identify when it comes to acne. That's for the risk factors per se.
Right. So these are the risk factors, or these are the people who are at risk for acne. Now, in our society, the very first thing that we do, as a tradition, is to go for home remedies whenever we see acne lesions on our face, or go to a chemist shop for any over-the-counter medication. We'll just go and say, "कि भैया देखो कुछ हो रहा है, pimple हो रहा है, कुछ दे दो." Or only when these condition worsens is when we go and land up in front of a doctor. That's the reality. Now, my question to you, doctor, is that what's your take on these practices? What do you think about home remedies or over-the-counter medication for acne? Do they really work, or we actually need to go and meet a right expert, a dermatologist like you, for the treatment at the very first place?
So, when you come to home remedies, I'm not per se a big fan of someone recommending a home remedy because nothing is natural today. We need to realize that. Everything right from what we eat since the morning till night is all processed, as simple as your water, right? So when you say that these are the natural ingredients, what we say that ये आपके किचन में मिल जाता है तो ये नेचुरल है, इसके लिए आपको कहीं और नहीं जाना, बट वो नेचुरल तो नहीं है. Everything is processed to come to your table today. Even your green leafy vegetables as matter of that. So there is nothing homemade right now. The earlier generation, like 15-20 years earlier, when your mom or my mom used to tell कि ये दही लगा लो या ये दूध लगा दो या ये टमाटो लगा, because the chemical content was less. Everybody used to make dahi. They used to try churning the curd at home. So the remedies work for curd per se. They used to get your basin, everything from natural sources. So it used to be helpful. But today, when you tell me that I'm applying basin, I'm applying lemon, applying turmeric, and all of these things as home remedies, they're only going to disrupt the skin barrier. When it comes to your skin barrier, if you disrupt it, you become more prone for acne, even if you're not an acne prone skin. That is called as something called as acneiform eruptions. So you don't want that. So this is coming to your home remedies part. And secondly, which is like Indians are known to go to the chemist. The chemist will be your best friend always. They go and they'll pick up some tube and they will start, and they trust that chemist more than they trust their doctor. And that's a fact today. But you need to realize that that chemist will give you something called as a steroid cream. The moment you apply steroid cream on your face, 2-3 days your face is glowing, because that's how steroid works. It helps you decrease the inflammation, it will decrease your redness and everything, and you're happy and you're like, okay, my acne has disappeared. The chemist wala is the genius present right now. But the moment you withdraw steroids, you will see its side effects. Your acne will become more cystic, that means more painful ones within a few days of stopping the steroid cream. Your skin sensitivity to sun increases, not even sun, any light per se. You will start having redness, dryness. The thinning of skin is seen very widely. So these are the drastic changes. And then you again enter the loop of applying that same steroid cream again. So again, you are damaging the already damaged skin, and you don't come to a dermat thinking that अब क्या मैं कर सकती हूँ अपने आप से या कर सकता हूँ. But no, going to your chemist. What I recommend is, if you're not sure what you have to do, see a board certified dermatologist per se. Go to them. just get identified what acne you have. Do you need
Yeah.
treatment for that acne, or you can just manage it with a simple skincare routine? That's the simplest thing that you can do. Identifying your skin type, identifying the things that you need to do is the most important thing in any journey of skin.
That's a very good advice, actually. The irony is, doctor, when you go and ask somebody who is, facing acne problems, that why you are not going and seeking advice from a qualified doctor, and the person will say कि डॉक्टर तो स्टेरॉइड्स दे देंगे और हम क्या कर रहे हैं, हम खुद केमिस्ट शॉप से बिना जाने स्टेरॉइड्स इस्तेमाल कर रहे हैं और लंबे वक्त तक कर रहे हैं without knowing what the consequences are going to be like. So it's a vicious circle. And to get out of it, you need to go and consult an expert dermatologist at the very first place. Now, doctor, when a person with acne problems come to you, are there any, how do you diagnose? Are there any tests or something, or just by clinical investigation, etc., just by physically checking, you can say that, okay, these are the acnes and this could be the reasons, etc. What's the way of diagnosing acne?
See, acne is going to be a chronic condition. Okay, so you need to realize and accept the fact that you are an acne prone skin. So accepting the fact is the first part of the counseling which has to be done by a doctor. When you come to me, when we have a chat, this I first ask you and explain to you that behavior, and it's going to be chronic, but we're going to get you to a condition where it's going to be only management at home. Now, coming to how you diagnose your acne, it's a first consultation when a patient sits in front of me. It's my job to know about their diet. It's my job to know what are their lifestyle they are living in. Are there any medications going on? Are there any hormonal changes that they are facing if it's a female? For males, we tend to ask if there are any protein powder or they are into gymming or any other medications that they are taking into. This becomes the first step of diagnosing an acne patient. Now, the second step here is that if they have any conditions viable, like they have any hormonal issues, have they seen any gynec per se? Have they got their hormonal profiling done per se? If those are positive, negative, depending on that, then we recommend if it's in hormonal acne, whether to go undergo a battery of tests or not. But in my practice, I've seen that 80% of the acne that we treat are without the blood test. We only recommend 20% of them because they have already undergone their hormonal therapy. They have already seen a gynec for their PCOS. For the males, when they have cystic acne, it is mostly aggravating because they are on something called as whey protein that will increase your testosterone levels for building muscles. So that's again an aggravating factor for your acne. Then you come to the products that they're using at home. Now, because we are on Instagram, so I need to state that we are in a wide array of knowledge. Everybody is self-medicating. Everybody follows a so-called skin expert on Instagram. Everybody recommends, chachi ko acha lag gaya to main use kari. Acha, my cousin has used this cream. My cousin has used that serum. So we are using it. Those are further aggravating your acne. So that's the third part of the history that we started in the few years down now, that we have to ask you what is the skincare regimen that you're using. Because a lot of time it's the products that you use at home that is aggravating your acne per se. So that is another counseling process. So it's a wide 3 to 4 steps where we go on, we have a conversation with you, we understand what is your regimen, what is your diet, which is so important. And then if required, we will give you a battery of tests to be conducted.
Right. We even, go till the extent where we take the prescription of a friend or family who had acne and take the medicines and start treating ourselves. We need to understand that acne is a very individualistic thing, why acne? I'm having acne, the reason, the cause may be different from my friend or anybody else. So it need individualistic approach as well. So you need to go and first of all find out what is the cause, and
Exactly.
then
Yeah.
definitely the doctor will help you. Right. So, doctor, now moving to the treatment part, what are the treatment options available?
So when you come to a treatment option, like I said, the first treatment option starts from your home, right? Your diet, your lifestyle is going to see how much your acne is going to last for you, how long your acne is going to trouble you. So first change in the treatment has to be your diet and lifestyle modification, because that's going to be 80% of your treatment. Okay. But the other part that we come to, that is the remaining 20%, there you come to either topical applications, and there's something called a systemic or oral medications that you are on. Now, when you come to topical medications, depending on the severity of the acne, the dermatologist will see you, assess your skin, whether you have comedonal acne, whether you have cystic acne, or you have any nodules kinds of acne. And so, depending on that, you range from topical antibiotic therapy to your benzoyl peroxide. Sometimes salicylic acid has a spot treatment, or you have your azelaic acid has those. But those are depending on the acne that we see. Now, when we come to an oral medications per se, there are again a wide array. We start with an antibiotic therapy, or we can start with the isotretinoin therapy, which is the wide stray of the acne treatment, or a combination of both of them. Sometimes, if you're dealing with hormonal acne, then there's a hormonal therapy that you're being put on, which lasts from anywhere between 3 to 6 months. So, this is what basic treatment goes on. Then, person to person, your skin, my skin, third person skin is all different. So then we decide how's your skin, how your skin barrier is compromised or not, and then both combinations can also be given of a topical and oral medications. Both.
Are there procedures as well for acne and the marks that they leave?
Yes, there is a wide array of procedures that can be conducted for an acne-prone skin. But you need to remember that these are all dermat in clinic procedures, because I am seeing a lot of people doing at home chemical peeling. I'm doing a lot of parlor people doing chemical peeling. So those are a big no. So when I state here, I state that these are in clinic procedures that are recommended for you. Per se, the chemical peeling first. Now, these chemical peeling, depending on the lesions, can be either glycolic based ones, that is the AHA peel, or you can have the BHA peel, that is a salicylic acid peel, or a combination of both of them. So this is the first. This helps to dry out your acne faster, especially the big cystic ones. Then post that, like once your active acne has settled, then you have any scars. We normally say as khatte or open pores that we say. For those, we have the other being the laser therapy, fractional CO2, or something called as micro needling, which is in trend today. So this is the micro needling radio frequency, which you can combine with PRP or the serums that can be recommended according to your skin type.
Right. And doctor, what is the maintenance therapy like? Because with acne, one big concern is that it will come back. So maintenance is equally important. So what is the maintenance therapy for acne?
So when you call about maintenance therapy, you first need to have the inductive phase. Now, what is inductive phase? That is when you come to me, I give you the treatment, I tell you that this is what is going to happen depending on how severe it is. It can last anywhere between 3 to 6 months. Post this, you don't want to come and see a dermat every month, right? Nobody wants to see that. That's when we've taken care of the severity, is when we tell you now you're on maintenance phase. Now, maintenance phase is only possible when I have dealt with you, I have seen your acne, I know what products work for you, and then I put you on maintenance therapy depending on your skin type, your skin lesions. And now, maintenance therapy again can be from your gentle cleansers to your sunscreen to your moisturizer, has your AM routine. And for your PM routine, again, a gentle cleanser or the other kind of cleansers that help for exfoliation, a mild exfoliant cleanser, and then an anti-acne serum or oral medication can be also recommended, and a topical medication. So this is basically what can become into your maintenance therapy.
Right. So a maintenance therapy routine, a skincare regimen is equally important. And doctor, before we move on, because you pointed out about how important it is to take care of your skin on a regular basis. Now, people are mostly confused about their skincare routine. They'll buy n number of products and don't know what to do with it. So what is, because as you said, you need a cleanser, a moisturizer, a sunscreen, a serum maybe in the night. So what are the basics that we need to have and the way we should use it? We would like you to shed some light over that as
I am so happy that you brought about this question, because see, anything basic, when you say, it has to be cleanser, moisturizer, and your serum. Now, either your sunscreen or your serum, depending whether it's an AM or a PM routine. But to be very wide, always use a gentle cleanser, irrespective of what skin type you have. Because see, if you're not going to a dermat, might as well use something which is safe, right? So go for a gentle cleanser, go for a good moisturizer depending on your skin type. Now, if you're a dry, sensitive skin, there are a lot of products that come has a labeled one for dry, sensitive skin. Go for those ones. Then if you're an oily prone skin, then go for products which is non-comedogenic, has their label. They will have a label called as non-comedogenic. That is basically those don't clog your pores, and that's how that will not trigger your acne. And a sunscreen on top of that if you are an AM routine. And then that is again depending on your skin type. You can go from an oily skin based sunscreen to the mattest sunscreen available in the world today for your acne prone skin. Something called as for a dry sensitive skin also, which would be a little dewy in consistency as well. Then when you come to your night routine, keep it basic. There I have seen people going for 7 step skin, 8 step skincare routine, which is a myth. You will do it for like 2 weeks, 3 weeks, and then you're done. You're back to zero. So keep it basic. You keep a gentle cleanser, you double cleanse if you're wearing makeup, good enough. Come out, just tap dry your skin, don't rub it. I've seen patients rubbing their face with a towel because they think कि पूरा धूल मिट्टी निकल जाएगा. वो नहीं करना. एकदम gently just tap dry your skin. Then you can use any actives if you are on any active. And again, when I say of active serums, only use one active at a time. Don't go into a combination of niacinamide, hyaluronic acid, vitamin C, retinol, everything. They put it in a bottle and say, ये लगा लो. ये तुम्हारा magic है और ये लगा लो. You will end up with a lot of irritation. So use only one active at a time if you're using. And then depending if you need a moisturizer, then seal it with a moisturizer and you're good to go then. That's the basic, I can tell you, like the simplest way of using a skincare.
Right. Many times people, especially with oily skin, feels that it's the dirt that's causing, or the excess of oil that's causing acne, and they'll keep on washing their face with a
Exactly, yeah.
face wash. They'll, right. So is it a good practice or what's the right way?
So when it comes to cleansing your face, twice, that's all. And sometimes if you're outside and you have been in the mud or anything, you can use it thrice, not more than that. Like face wash is just going to help you with the outside cleansing, right? So you can't keep repeating the face wash and then don't close you are not using a moisturizer, you're not using a sunscreen. You indirectly damage your skin twofold more, because you've disrupted your skin completely from up. You've been rubbing your skin, then you expose it directly to sun, dirt again. The cycle never ends. So twice is more than enough. See, nobody today is out in the playground or is playing in the dirt or is gone into a muddy bath or anything. If you are doing that, well and good, use it thrice. But if you're just traveling and all, and you're coming from your office, mostly everybody's traveling, go to their office, use a tissue paper, dab your face with a tissue paper. All your dirt that is stuck to your face will be out with that. That's all. So nothing more than twice is recommended for your face.
Okay. And now, doctor, because you also mentioned sunscreen in our regular routine skincare regimen, the thing is that many times people who have oily skin or who are acne prone or who are having acne currently, they'll say that, why layering up with sunscreens? So why sunscreens are so important, and for acne prone skin, do you still advise sunscreen?
Yes, definitely. Because we don't want any UV damage to further worsen your acne. See, this is a science that has been seen that UV lights. Now, these UV lights can be from the sun, your blue lights that is from your phones or your laptops. This will cause an inflammatory process on your face. So what it does, it increases the redness of your face, which is normally seen in your acne prone patients. And secondly, what marks you already have from your previous acne will get darkened. So the more darker the patches, the more severe the treatment goes on. So you have to be very consistent with the sunscreen application if you want to make your acne prone skin more bearable, less sensitive to sunlight, and lighten your dark spots. So sunscreen is a must.
Right, so sunscreen is really important. We have some questions from our viewers. We have Pooja with us. Her question is, how does diet influence acne? Initially, also you said that diet also plays an important role, and many a times we see people saying that don't have dairy products, don't eat chocolates, etc. So please enlighten us on that as well.
So there are a lot of research papers stating that your diet is can make your acne worse or can increase the inflammation. The simple logic that is found out is that when you have something which is very high insulin spiking, this that is your high glycemic index food, they set in an inflammation kasar. So the cascade of that inflammation goes on continuously, and that's how your insulin keeps spiking up when you have all these high glycemic index. Now, what are high glycemic index foods first? Your junk foods, all your per se junk foods, your breads, your burgers, your pasta, your oily food, your junk food, they can spike up your insulin. And that's how your acne can flare up. Now, the same logic is for your dairy products also. But now again, when we come to dairy products, we as dermats or we as doctors are more focusing on your bakery products, your sweets, your chocolates, your cookies, and all of those stuff, which again it gives you an insulin spike, and that's how your acne can. अब किसी ने बोला कि नहीं, I'm having a glass of milk. Nobody has a plain glass of milk. Okay, everybody puts sugar, everybody puts Bonvita or something like that. That's again going to spike up. So per se, a glass of milk is not going to flare up your acne. What you put in that milk is going to flare up your acne. So you have to be mindful of what you eat. So a good
Right.
diet where you have a lot of veggies, where you have a lot of fruits, you have good water intake is going to make a hell lot of change for your skin.
Okay. We have one more question. How does sun exposure affect acne?
So I just discussed about it, that sun exposure is basically setting in the inflammation again, because the lights, that is the UV lights, can increase the inflammation on the skin, making your skin more dry, more sensitive, more red. Secondly, it will also worsen your pigmentation, which is called PIH. In our terms, we call as PIH, that is your post-inflammatory hyperpigmentation. That can get worse with sunlight. So that's why we recommend a sunscreen in your routine, for even for an acne prone patient.
Right. So we have Radhika with us, and her question is there a correlationship between acne and allergies?
Not per se that acne and allergies come together, but see, allergies will cause your skin to like have those minute breaks because you are an allergic skin. So that can trigger because your skin barrier is disrupted, so that can cause you acne from eruptions. But per se, there's no correlation between an allergic patient and acne patient.
Hmm. Okay. Rocky is here. His question is, how does sweating affect acne-prone skin?
Yeah. So when you come to sweating, the basic mechanism is that your body will produce more sebum. Right? Sebum is the oil glands. Your oil glands are hyperactive, basically, when you're sweating a little bit more. So all the dirt, all the sweat clog your pores, and then that becomes the breeding ground for the bacteria, and then the inflammation of your acne worsens with that. That's the cycle that continues then.
And that's why we saw, especially during the time where we were wearing a lot of masks on our face, that, due to the sweat accumulation, a lot of acne uh, was there.
Yeah.
So we have Meenal Verma with us. Hi, Meenal. Her question is, can certain medications worsen acne?
Yes, there is a correlation between a few medications that can worsen acne, especially if you're on oral steroid tablets per se. That can give you something called as monomorphic acne. Then there are a lot of other, like if you're on anti-epileptic drugs, those are also known to trigger acne in few patients. Now, these are a few indications where you can, like, that's why we ask you your drug history, like any medications you are on. But per se, your diabetes or antihypertensive drugs, we've not seen the correlation. These are a few drugs which can trigger your acne.
Okay. We have Ajit Kumar with us. Hi, Ajit. Thank you for joining us. His question is, can acne be exaggerated by environmental factors?
Yes, and no to both of them. Because the environmental factors, we need to know where you are. Like, what is the environmental factors? Environmental
Mhm.
factors, even like a person who's not prone to acne is also there in that environment. Even you are there in. But if you are an acne prone skin, that means you have oily glands, you have sebum collection, you have any family history of acne. That is only when the humid climate or the hot weather can further aggravate your acne. So it depends. A lot of genetic pooling also comes into play. Your diet comes into play. Your environment then comes into play. So it's a yes and no both.
Okay. And Doctor, one more question from my side is, one thing that we love after we have acne is to prick the acne. That's the easiest way for us to I mean, that's what we believe, that we'll quickly get rid of the acne. But of course, it's not a good practice, I'm sure. We would like you to tell us what to do, what is the right way, and why pricking is not a good idea.
See, like when patients come to me, I give them a simple example. Have you seen a balloon?
Hmm.
So if when you see a balloon and when you press it in the between, the balloon comes in two parts. जितना ऊपर गया है उतना नीचे भी गया है आपका balloon, right? Because you've compressed it. The same thing happens to your acne. So when you give a pressure to it, you've removed the upper part, but you've also put the inflammation down more because
Okay.
all that, and then you have exposed it to the environment without doing any. Now that becomes an open wound for you. Now that open wound will have pus already there. It will have your serous fluid that is going on. Now that becomes your again breeding ground for your bacteria, because that's how they thrive and that's how they will grow. Within a few days of that acne settling, you will just see a nearby acne popping up. That's how acne is. This is just one part of what you've done to your skin. The second part is you've made it open. Now that can lead you to open pores or your open scarring, which is major thing. Third, you've created a wound. You are going to be 100% more prone to developing PIH, pigmentation, and it just keeps getting worse. And the moment you keep doing it on a constant basis, your pigmentation now then comes from deep layers of your skin, and it will keep getting worse. So big no. If you are having an acne, stop popping it, stop picking at it, stop removing the scabs. It is only going to do you harm. No touching of the face, especially when you don't need to. Okay. Then if you have an acne, go for spot treatment. I've seen people when they keep a spot treatment of they have something applied, they are less prone to touching their face. So that's how you protect that pimple. You know that there's something applied, you don't want to fidget with it. So use a spot
Hmm.
treatment instead for that.
Okay, doctor. And doctor, before we sum up the whole session, any take-home message, anything that we have missed out on?
Yes. So see, Acne per se, like we've discussed it in this wide, my take home message for all the viewers who have joined us today is that have a constant skincare routine. You are not going to have an effect within 10 days. You need to be constant. You need to be patient with your skin. It is going to heal. It is a healing organ, right? At the end of the day. So you just need to be patient with your skin and it will give you results. Don't use 10,000 products that are there over the market today. Please don't go because a reel became famous because किसी ने एक product आपको बोल दिया. Don't go for that facade. See a dermat, it will cost you one consulting fees, but that's how you know your skin type. You will know, your dermat will know what to recommend you. फिर मत जाना, you use those products, get used to that regimen and you will see the difference. Okay, and don't ever pick at your skin, and we've discussed it. Don't go for procedures that are available outside your derma clinic just because some parlor auntie कर रही है या some other is doing. Get yourself a board certified dermatologist. Only then let them touch your skin, do chemical peelings there, and that's all. And have a healthy lifestyle. So much importance, so much emphasis is on your lifestyle. Even if you don't want to see a dermat or a skin specialist, have your food right, have a good protein rich diet, have a good well balanced diet, and you're going to go a long way.
Absolutely. It was such a pleasure to talk to you, Dr.
Same
Rhea. It
here.
was wonderful, a very informative session indeed. Thank you so much for your valuable time.
Thank you for having me. You were great. Thank you.
Thank you, Doctor, and viewers. Thank you for joining us. Stay connected with us on our Beautiful Spotless Skin page. Have a great day ahead. That's all for today. Goodbye. Good day.
Bye. Bye.